Thank you for joining us today on Medical Mastery. My name is Arnold RN, and I will be your educator for today's review. Let's get started. Nursing interventions that can help the patient to relax and sleep restfully include all of the following except A. Have the patient take a 30 to 60-minute nap in the afternoon. B. Turn on the television in the patient's room. C. Provide quiet music and interesting reading material. D. Massage the patient's back with long strokes. The correct answer is A. Have the patient take a 30 to 60-minute nap in the afternoon. Napping in the afternoon is not conducive to nighttime sleeping. There are few considerations about naps. For example, a short daytime nap of 15, 30 minutes can be restorative for elders and will not interfere with nighttime sleep. On the other hand, insomniacs are cautioned to avoid naps. Quiet music, watching television, reading, and massage usually will relax the patient, helping him to fall asleep. Restraints can be used for all of the following purposes except to A. Prevent a confused patient from removing tubes, such as feeding tubes, IV lines, and urinary catheters. B. Prevent a patient from falling out of bed or a chair. C. Discourage a patient from attempting to ambulate alone when he requires assistance for his safety. D. Prevent a patient from becoming confused or disoriented. The correct answer is D. Prevent a patient from becoming confused or disoriented. By restricting a patient's movements, restraints may increase stress and lead to confusion rather than prevent it. Restraints in a medical setting are devices that limit a patient's movement. Restraints can help keep a person from getting hurt or doing harm to others, including their caregivers. They are used as a last resort. The other choices are valid reasons for using restraints. Nurses and other healthcare providers often have difficulty helping a terminally ill patient through the necessary stages leading to acceptance of death. Which of the following strategies is most helpful to the nurse in achieving this goal? A. Taking psychology courses related to gerontology. B. Reading books and other literature on the subject of thanatology. C. Reflecting on the significance of death. D. Reviewing varying cultural beliefs and practices related to death. The correct answer is C. Reflecting on the significance of death. According to thanatologists, reflecting on the significance of death helps to reduce the fear of death and enables the healthcare provider to better understand the terminally ill patient's feelings. It also helps to overcome the belief that medical and nursing measures have failed when a patient cannot be cured. Thanatology is the science and study of death and dying from multiple perspectives: medical, physical, psychological, spiritual, ethical, and more. A 72-year-old female patient with a history of type 2 diabetes and hypertension was admitted to the medical surgical unit due to a minor stroke. On assessment, the nurse noted generalized skin dryness, particularly on the arms, legs, and face. The nurse understands the importance of skin integrity, especially considering the patient's age and comorbidities. Which of the following nursing interventions should the nurse consider when addressing the patient's skin dryness? Select all that apply. A. Consult the dietitian about increasing the patient's fat intake and take necessary measures to prevent infection. B. Use hypoallergenic soap when bathing the patient. C. Encourage the patient to drink at least 2 liters of water per day. D. Coordinate with the physician to refer the patient to a dermatologist. E. Replace hospital-issued gowns with home-laundered ones. F. Frequently apply a hydrating lotion to the patient's skin. G. Offer the patient warm tea thrice daily. The correct answers are B, C, and F. Using hypoallergenic soap prevents further irritation and drying of the skin. Drinking adequate water assists in maintaining skin hydration and health. Applying a hydrating lotion helps seal in moisture, preventing further drying and nourishing the skin. These interventions directly address the root cause of skin dryness and provide comprehensive care to promote skin integrity. While some of the other interventions may have benefits in certain contexts, B, C, and F are the most directly applicable to the patient's skin condition in this scenario. Vivid dreaming occurs in which stage of sleep? A. Stage 1 non-REM. B. Rapid eye movement. C. Stage 2 non-REM. D. Delta stage. The correct answer is B. Rapid eye movement. Other characteristics of rapid eye movement, REM, sleep are deep sleep. The patient cannot be awakened easily. Depressed muscle tone, and possibly irregular heart and respiratory rates. This stage usually starts 90 minutes after falling asleep, and each of the REM cycles gets longer throughout the night. The first period typically lasts 10 minutes, and the final one can last up to an hour. Which of the following is the nurse's legal responsibility when applying restraints? A. Document the patient's behavior. B. Document the type of restraint used. C. Obtain a written order from the physician except in an emergency, when the patient must be protected from injury to himself or others. D. All of the above. The correct answer is D. All of the above. When applying restraints, the nurse must document the type of behavior that prompted her to use them, document the type of restraints used, and obtain a physician's written order for the restraints. Nurses are accountable for providing, facilitating, advocating, and promoting the best possible patient care and to take action when patient safety and well-being are compromised, including when deciding to apply restraints. Which of the following symptoms is the best indicator of imminent death? A. A weak, slow pulse. B. Increased muscle tone. C. Fixed, dilated pupils. D. Slow, shallow respirations. The correct answer is C. Fixed, dilated pupils are a sign of imminent death. A nurse caring for a patient with an infectious disease who requires isolation should refer to guidelines published by the A. National League for Nursing. B. Centers for Disease Control. C. American Medical Association. D. American Nurses Association. The correct answer is B. Centers for Disease Control. The Center of Disease Control publishes and frequently updates guidelines on caring for patients who require isolation. CDC is responsible for controlling the introduction and spread of infectious diseases and provides consultation and assistance to other nations and international agencies to assist in improving their disease prevention and control, environmental health, and health promotion activities. Which is the correct procedure for collecting a sputum specimen for culture and sensitivity testing? A. Have the patient place the specimen in a container and enclose the container in a plastic bag. B. Have the patient expectorate the sputum while the nurse holds the container. C. Have the patient expectorate the sputum into a sterile container. D. Offer the patient an antiseptic mouthwash just before he expectorate the sputum. The correct answer is C. Have the patient expectorate the sputum into a sterile container. Placing the specimen in a sterile container ensures that it will not become contaminated. A sputum specimen is obtained for culture to identify the microorganism responsible for lung infections, identify cancer cells shed by lung tumors, or aid in the diagnosis and management of occupational lung diseases. The other answers are incorrect because they do not mention sterility, and because antiseptic mouthwash could destroy the organism to be cultured. The best way to decrease the risk of transferring pathogens to a patient when removing contaminated gloves is to A. Wash the gloves before removing them. B. Gently pull on the fingers of the gloves when removing them. C. Gently pull just below the cuff and invert the gloves when removing them. D. Remove the gloves and then turn them inside out. The correct answer is C. Gently pull just below the cuff and invert the gloves when removing them. Turning the gloves inside out while removing them keeps all contaminants inside the gloves. They should then be placed in a plastic bag with soiled dressings and discarded in a soiled utility room garbage pail, double-bagged. The other choices can spread pathogens within the environment. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the IV site reveals that it is warm and erythematous. This usually indicates A. Infection. B. Infiltration. C. Phlebitis. D. Bleeding. The correct answer is C. Phlebitis. Tenderness, warmth, swelling, and in some instances, a burning sensation are signs and symptoms of phlebitis. Superficial phlebitis affects veins on the skin surface. The condition is rarely serious and with proper care usually resolves rapidly. Sometimes people with superficial phlebitis also get deep vein thrombophlebitis, so a medical evaluation is necessary. The nurse is teaching a patient to prepare a syringe with 40 units of U100 NPH insulin for self-injection. The patient's first priority concerning self-injection in this situation is to A. Assess the injection site. B. Select the appropriate injection site. C. Check the syringe to verify that the nurse has removed the prescribed insulin dose. D. Clean the injection site in a circular manner with an alcohol sponge. The correct answer is C. Check the syringe to verify that the nurse has removed the prescribed insulin dose. When the nurse teaches the patient to prepare an insulin injection, the patient's first priority is to validate the dose accuracy. The next steps are to select the site, assess the site, and clean the site with alcohol before injecting the insulin. A patient has just received 30 milligrams of codeine by mouth for pain. 5 minutes later, he vomits. What should the nurse do first? A. Call the physician. B. Remedicate the patient. C. Observe the emesis. D. Explain to the patient that she can do nothing to help him. The correct answer is C. Observe the emesis. After a patient has vomited, the nurse must inspect the emesis to document color, consistency, and amount. Nausea or vomiting is another commonly seen adverse effect that is expected to diminish the following days to weeks of continued codeine exposure. Antiemetic therapies in oral and rectal formulations are available for the treatment of nausea or vomiting. A patient is catheterized with a number 16 indwelling urinary Foley catheter to determine if A. Trauma has occurred. B. His 24-hour output is adequate. C. He has a urinary tract infection. D. Residual urine remains in the bladder after voiding. The correct answer is B. His 24-hour output is inadequate. A 24-hour urine output of less than 500 milliliters in an adult is considered inadequate and may indicate kidney failure. This must be corrected while the patient is in the acute state so that appropriate fluids, electrolytes, and medications can be administered and excreted. Indwelling catheterization is not needed to diagnose trauma, urinary tract infection, or residual urine. A staff nurse who is promoted to assistant nurse manager may feel uncomfortable initially when supervising her former peers. She can best decrease this discomfort by A. Writing down all assignments. B. Making changes after evaluating the situation and having discussions with the staff. C. Telling the staff nurses that she is making changes to benefit their performance. D. Evaluating the clinical performance of each staff nurse in a private conference. The correct answer is B. Making changes after evaluating the situation and having discussions with the staff. A new assistant nurse manager should not make changes until she has had a chance to evaluate staff members, patients, and physicians. Changes must be planned thoroughly and should be based on a need to improve conditions, not just for the sake of change. The nurse is assessing a post-operative adult patient. Which of the following should the nurse document as subjective data? A. Vital signs. B. Laboratory test result. C. Patient's description of pain. D. Electrocardiographic, ECG, waveforms. The correct answer is C. Patient's description of pain. Subjective data come directly from the patient and usually are recorded as direct quotations that reflect the patient's opinions or feelings about a situation. Subjective data provide clues to possible physiologic, psychological, and sociologic problems. They also provide the nurse with information that may reveal a client's risk for a problem as well as areas of strengths for the client. The information is obtained through interviewing. Vital signs, laboratory test results, and ECG waveforms are examples of objective data. A male patient has a soft wrist safety device. Which assessment finding should the nurse consider abnormal? A. A palpable radial pulse. B. A palpable ulnar pulse. C. Cool, pale fingers. D. Pink nail beds. The correct answer is C. Cool, pale fingers. A safety device on the wrist may impair circulation and restrict blood supply to body tissues. Therefore, the nurse should assess the patient for signs of impaired circulation, such as cool, pale fingers. A palpable radial or lunar pulse and pink nail beds are normal findings. Before administering the evening dose of a prescribed medication, the nurse on the evening shift finds an unlabeled filled syringe in the patient's medication drawer. What should the nurse in charge do? A. Discard the syringe to avoid a medication error. B. Obtain a label for the syringe from the pharmacy. C. Use the syringe because it looks like it contains the same medication the nurse was prepared to give. D. Call the day nurse to verify the contents of the syringe. The correct answer is A. Discard the syringe to avoid a medication error. As a safety precaution, the nurse should discard an unlabeled syringe that contains medication. The other options are considered unsafe because they promote error. A female patient who speaks a little English has emergency gallbladder surgery during discharge preparation. Which nursing action would best help this patient understand wound care instruction? A. Asking frequently if the patient understands the instruction. B. Asking an interpreter to replay the instructions to the patient. C. Writing out the instructions and having a family member read them to the patient. D. Demonstrating the procedure and having the patient return the demonstration. The correct answer is D. Demonstrating the procedure and having the patient return the demonstration. Demonstrating by the nurse with a return demonstration by the patient ensures that the patient can perform wound care correctly. One of the leading causes of medical errors in the United States is miscommunication between patients and providers. When patients with limited English proficiency cannot adequately communicate their needs, they are less likely to comply with medical instructions and receive vital services. A female patient exhibits signs of heightened anxiety. Which response by the nurse is most likely to reduce the patient's anxiety? A. Everything will be fine, don't worry. B. Read this manual and then ask me any questions you may have. C. Why don't you listen to the radio? D. Let's talk about what's bothering you. The correct answer is D. Let's talk about what's bothering you. Anxiety may result from feelings of helplessness, isolation, or insecurity. This response helps reduce anxiety by encouraging the patient to express feelings. The nurse should be supportive and develop goals together with the patient to give the patient some control over an anxiety-inducing situation. Because the other options ignore the patient's feelings and block communication, they would not reduce anxiety. Thank you for joining us today on Medical Mastery and for making it to the end of the video. We hope you enjoyed testing your nursing knowledge with our practice questions. If you found these questions helpful and want to stay updated on more engaging nursing content, be sure to subscribe to our channel. By subscribing, you'll be the first to know when we release new practice questions, study tips, and valuable insights to help you excel in your nursing journey. Thank you for being a part of our nursing community, and we look forward to seeing you in our next video. Until then, happy studying and take care.